Hey, I'm Jennifer Rodriguez from Think Holistic Fitness, and we are a training facility that specializes in helping women of all ages get to the body composition that they would like and get to a level of functional health that they like. And this is...
Hi, I'm Erin Blankenship. I'm the proud owner of Thrive Physical Therapy. I'm an orthopedic physical therapist with specialty in sports medicine. And Jennifer and I work together on a lot of our clients to help them achieve their goals and get out of painful problems.
So one thing that we see quite often, especially for women over 40, but women under 40 as well, are issues that they come to us with that have been chronic over time. They're constantly complaining of, we're going to point out three main things right now: knee problems, lower lumbar problems, and upper neck and shoulder problems. So we wanted to provide some education to the community to help them understand why these things are chronic and why they're happening over and over and over again. We describe it like you're not rotating the tires on your car.
What we see really consistently across our population is a general lack of stability. And we throw those terms around like it's no big deal and everyone knows what we're talking about. But to really break it down, at the root of exercise, stability is just your base, your foundation, your ability to really maintain a correct joint position while you're going through an exercise, whether it be a simple bicep curl or a really compound movement like a squat or a deadlift.
So when people come in to train with us, we put them through some type of a sort of functional movement screen to assess their pattern when they're training. And one of the things that we do is we work specifically on getting them into a much better pattern that aligns so they don't constantly keep re-injuring themselves. We use
a lot of postural restoration, which is a philosophy that has a lot to do with optimizing that same alignment that we're alluding to, and really talks about the core. Again, core, emotion, are a word that just gets thrown around in fitness and in healthcare like we all know what we're talking about. But at the end of the day, the core is your ability to unload your joints by creating a stable base or foundation, requiring really integrated timing of your deep abdominal muscles, your glutes, of course, and your hamstrings, which are three really overlooked areas in not only performance and strengthening, but also in physical therapy and rehabilitation.
So we're going to talk about three main exercises that are ones that typically cause problems when people come in and say, oh, I've always done lunges, but they hurt my back. Oh, I've always done squats, but I wind up with pain in my hip flexors. Oh, I've always done push-ups, but then my neck starts to hurt. So we're going to talk about some different ways how to avoid these problems and things that we see when we are training clients as to why these things happen.
The first exercise we're going to talk about is the squat. Obviously, everybody knows squatting is a great exercise. It incorporates lots of different muscle groups, big muscle groups, which of course increase metabolism and will help increase your lean muscle mass. However, squatting is also a great place to get yourself in trouble or to continue fueling those bad patterns that could be leading to painful problems in your training. So Jennifer's going to take us through a couple examples of what a squat should not look like and how your possible lack of stability and timing to maintain your base could be getting you in trouble.
So one thing, put people in a position like this and say, let's see what your general squat looks like. A lot of times I see this. Okay.
See that big curve in that low back there? That is a complete lack of core or deep abdominal control right there that we're seeing.
Then what I ask people is, what are you feeling while you're hanging out down here? Okay, most people say the tops of their legs, their thighs, their quads, okay, and their knees. And sometimes some people say the upper part of their glute muscles, kind of, sort of, but only not entirely.
Right, and in this position, as you can see that Jennifer's doing this incorrectly, we're creating a lot of compression and compressive force through that low back, which over time will certainly add to that painful problem. Now, compound that by putting a dumbbell in Jennifer's hands or a kettlebell or adding a back load.
Yes.
All we're doing is fueling that propensity to not maintain that control. Unfortunately, a lot of people are trying to move a lot of load without the foundation to back that up.
So lifting heavy is great. Love lifting heavy. It's great for women, especially over 40. But when you have good stability, all your stabilizers need to be firing before you can even attempt heavy load on your back or even heavy load front loaded in your arms, because that's when people start getting into a lot of problems.
So if we take that squat into a better pattern and we have Jennifer repeat her squat, we're going to see that that low back stays nice and straight, that she is finding and feeling her glutes and hamstrings. She does have weight through her heels to maintain that good contact with the ground. And all those things will actually result in a decompression of your low back and not so much shear or force or load on your knees while you perform it. And it's gonna look a little more like this.
So I'm gonna go from my poor squat, my not right squat, and she's gonna coach me through to get me into a better squat.
So there's Jennifer's terrible squat. We're gonna ask her to pull that rib cage back and create that cylinder while gently tucking that tailbone under. You'll see all of a sudden Jennifer's got a fully straight spine. Now we're gonna ask her what she feels by pressing into her heels, and hopefully she's gonna tell us.
Now I can feel my hamstrings fire, my glutes fire. One of the big things is exactly what Erin said. We want to get our tailbone down slightly. We don't want to go here.
Overcorrection.
Okay.
Now we're creating the opposite problem.
That's the opposite problem, okay? And we don't want to be here, which I like to call the J-Lo.
The J-Lo.
Okay? Don't want to be here.
Love you,
We
Jeff.
have to be right there.
Perfect.
Okay? This requires being able to activate your hamstrings and glutes, which is one problem that we see a lot of because people's hamstrings and glutes are way
Over long, over weak. And that's just patterning, which is something we work really hard to build that foundation so that when you time an exercise like a squat or a deadlift or a lunge, and we're asking you to move your trunk, your hips, and your knees together, you can coordinate that whole pattern without getting yourself in trouble.
Thanks so much for joining us. We appreciate you watching. Next week I want you to tune in. We would like to show you
What you're doing wrong with your lunge pattern and what you can do to fix it.